Live Fit Podcast, episode 108. Heal Your Pain Now with Dr. Joe Tatta.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson. Thank you, everybody, for listening. As always, please take a moment and leave a review on iTunes or wherever you listen to this podcast. And most importantly, share it with somebody you care about. Because today I have Dr. Joe Tatta, a doctor of physical therapy and the author of Heal Your Pain Now, a revolutionary program to reset your brain and body for a pain-free life. Doesn't that sound great? As speaking from somebody with chronic back pain, that definitely sounds pretty good to me. So check out what he has to say. It's pretty amazing. And I think what's great about this is that he definitely does not prescribe pain medication. He says it does have its place here and there for incidentals. But overall, if you have chronic pain, you can get rid of it without getting addicted to opioids. So let's hear what Dr. Joe Tatta has to say and how you can heal your pain now. Hello, Dr. Joe Tatta. How are you doing today?
Great, Glenn. It's great to be here with you on the Live Fit podcast.
Well, I'm really glad to have you because, as a lot of my listeners have noticed, one of the common themes I've been working on lately is speaking with people who can help the body heal naturally. There seems to be, at least in my mind and the people I speak with, this trend to move away from the standard Western medications and surgeries and techniques that really just treat the symptoms instead of treating the cause. And when I heard what you had to offer, I really had to have you on the show. And for my listeners' sake, you have a book called Heal Your Pain Now. Before we go into that, would you like to give us a little background about yourself and how you got to be where you are now?
Sure. Well, for the past 23 years, I have been practicing physical therapy, so I have a clinical doctorate in physical therapy. And I also integrate other strategies into my practice, things like nutrition and some cognitive behavioral techniques to help people with chronic pain. But, people always ask me, how did you get involved in healthcare? Why did you want to become a physical therapist? And for me, it goes back way, way, way back in life. And my mother was a nurse, and she worked in the adolescent cancer floor of a hospital where she worked the night shift. Yeah, so during the day she would, take care of me and my brother and my dad and all the things that supermoms do. And at night she would go and she'd work on the adolescent cancer floor of a hospital taking care of other people's children. And this is in the 80s when cancer intervention and care wasn't so technologically advanced as it is today. So she'd be up at night with these kids, and over the course of about 5 years, she, got really burnt out, and she wound up having digestive issues and bounced back and forth between anxiety and depression and had issues with chronic pain. And I watched her, she was a nurse, so she knew a lot about the healthcare industry, and I watched her heal herself 100% naturally. So she did that through a combination of changing her diet, working on her stress level, beginning an exercise program. So from that early age, something was kind of imprinted in me where I said, wow, I wonder, what I can do with my life. Obviously, how can I help people with their health, basically? And for me, it was physical therapy. I was also a competitive gymnast as an adolescent. So I had the kind of sports and activity and physicality. So physical therapy was the kind of perfect blend of kind of health and medicine for me to pursue.
Wow, that's pretty awesome. You had a good start from the very beginning. And one thing I like about physical therapists is for the most part, they are using natural means. I mean, there are some devices that are used in there, but you are helping the body heal itself. Now, how did tell us a kind of a synopsis of your book, Heal Your Pain Now?
Yeah, so my book is called Heal Your Pain Now, the revolutionary program to reset your brain and body for a pain-free life. And it's a book about integrated natural strategies that you can implement in your life to heal your chronic pain naturally. And over the course of, my practice of 22 years, I have, even though my practice got bigger and more successful, the chronic pain numbers in our country and globally have risen dramatically. And chronic pain is actually our number one chronic disease. So if we look at the United States, which is where I live, we have about 116 million people that struggle with chronic pain, and that's more than heart disease, cancer, diabetes, and even HIV combined. So it's a big, major healthcare problem. So, I've had this thing in me. I've always wanted to write a book, and I knew it would be something about pain. So I was like, I could have did sports, so I could have did a specific injury. I'm like, let me go a little more globally and talk about chronic pain so that people would have kind of a how-to guide, if you will, on how they can heal themselves. And it's great, obviously, if you have chronic pain. It's also a great book if you're a clinician, or let's say you're a physician or an acupuncturist and you want to know how to kind of broaden your practice into the more integrated strategies. So for me, that book was obviously, it was, it's been a game changer for me as far as talking about chronic pain, because it's helped me reach more people. And it's also been really interesting to see people pick up the book and read it and say, wow, no one has ever told me this. I never knew I could heal from chronic pain with these natural remedies, because right now in the United States, we consume about 80% of the world's opioids.
What?
So,
really?
Yeah. We consume 80% of the world's opioids in the United States. So opioids are things, those are prescription painkillers, and we have an opioid epidemic as well as an addiction of opioids in the United States. And
so, okay, I wanted to back up on that because you said opioids. Does that not include the illicit recreational forms of the opioids, like heroin and morphine that are used not prescribed by a physician?
That's correct. That does not include that.
Okay.
So when I say 80% of the world's opioids, these are prescribed medications that typically a physician is prescribing for someone for some type of chronic pain syndrome. And, we've had in the past 50 to 100 years what's called a biomedical model for treating pain. So that means when you have pain and you go to, pick the doctor of your choice, there are many physicians that treat pain. Oftentimes the first thing they will prescribe for you, that they'll reach out their little white pad they'll prescribe, will be a prescription medication. Or they'll rely on a imaging study or surgery, and we are learning rapidly every day that those things don't work for chronic pain. So they may be there momentarily if you have chronic pain. They may get you through a difficult period of time. They may help weed out something, but it's not a long-term fix for chronic pain.
Yeah, I already had a shoulder surgery about a couple of years ago, and they sent me home with a bottle of 90 opioid. I forget what kind they were, but I couldn't believe it. 90? I said, are you trying to get me addicted to this stuff? It was insane that they thought I would need that much for that long. And if I did use it, I'm sure I would still be on it today. But I took about 4 of them and then chucked the rest.
Yeah, that's been the challenge, because, what happens with that is oftentimes people are told, take your prescription until it runs out. Because, for instance, if you take an antibiotic, you're told to take the entire prescription.
Right.
And that mentality carries over to other types of medications as well. Now, the challenge with opioids are that, 1, you may not need it for that long. And 2, everyone really reacts to an opioid very differently depending on what your specific biochemistry is. So if you're given a 30 to 90-day supply of opioids and you're not quite sure how you're going to react to it, you can become addicted, you can become dependent, and there are awful side effects to those medications.
I've seen the other end of that. Really upstanding citizens that are, own a financial company, or they're professional people, and they're the farthest thing from what you would picture as a drug addict, but yet they're trying to get that monkey off their back because they had some sort of accident, injury, and they needed them initially. And you don't want to chase the pain, because that doesn't work very well. If you don't take your opioid and then the pain comes on, you have to take twice as much, and it takes twice as long to squash it back down again. So they tell you to take it before it gets too bad, and as the duration of its effectiveness wears off, so 4 to 6 hours later, right? But then the problem is, how do you know when you can get away from it? And like I said, I've met a lot of people that were really struggling with this, and probably will for the rest of their lives. Not necessarily taking it, but anytime they take it again, it'll re-trigger that addictive response.
That's correct. So my message around opioids are that I'm not 100% against them. They have their place for certain types of chronic pain conditions. But I think our prescribing practices have to be very mindful. And we have to say, I'm going to prescribe the lowest dose for the shortest period of time and only integrate it with other natural strategies to help this person with their chronic pain experience. And the truth is that pain is an experience. It's not a symptom. So traditionally, we've looked at pain as a symptom. But chronic pain is an actual disease in and of itself. So we have to start to look at it differently. And my book is really about changing the paradigm around chronic pain and how we treat it.
So tell me a little bit more about how your definition of chronic pain being a disease. I'm not sure I understand that.
Yeah, it's a great place to start, and it's a great place to educate people. So let's talk first about acute pain. So let's say you fall right now and you scrape your knee and you have a little cut on your knee or a boo-boo, or you sprain your ankle, so you sprain the ligaments on the outside of your ankle, or let's say you even slip on ice and you break your arm. Those are all physical injuries. There's been some type of tissue damage. And with tissue damage, there's a natural inflammatory process where your body goes about healing that tissue. And that process is very predictable. So the human body has what's called an inflammatory process, and it'll heal tissue within 3 months, no matter what the injury is. Now, if you have that little scrape on your knee, that little boo-boo, that'll take, somewhere between 10 and 12 days, and that cut is gone. If you have a fracture, that'll take somewhere between 6 to 12 weeks, depending on it. If you have a surgery, same thing. It'll take upwards of 12 weeks. With chronic pain, it's pain that exists beyond that 3-month period of time. So it's pain that exists beyond the natural healing state of your body. So you say to yourself, okay, well, I broke my arm, let's say 5 months ago. Why am I still having this pain? So with chronic pain, we look less toward the actual tissue injury because we know that's healed. And we look more toward the brain and nervous system to try to figure out why is the brain still producing pain as this warning sign, or why is it still producing pain as a sign of protection? Because ultimately, pain is about protection. But sometimes, and we don't know why, in some people, that pain will persist or the brain keeps producing pain as a means of protection even though the injury is healed.
Okay, I get it. And how is that a disease?
Well, it becomes a disease in and of itself because with chronic pain, there are changes that happen in the brain both structurally and functionally. So structurally, the parts of the brain that are responsible for pain continue to produce pain, so to speak, for a longer period of time. And the other thing that's really interesting about chronic pain is that because chronic pain is both a sensory and emotional experience, you don't actually need to have a physical injury for chronic pain to develop. And we see this most readily or it's most observable in those who have some kind of history of trauma. And it's not a physical trauma, it's an emotional trauma. So let's say you've been, abused as a child, or you have PTSD. We see that oftentimes in our veterans that come back from war, where they may have observed some awful atrocities, but there is no physical injury to them. But for some reason, their brain and nervous system is still producing pain as this output. It's producing pain as a way to alert yourself that there's some kind of behavioral change that's needed for your pain to heal.
I gotcha. So let me use me as an example because I've been dealing with chronic low back pain. I have a slight amount of scoliosis. I'm kind of long in the torso. I've been a avid bicycle rider for all of my life, and I have 2 facets on L4, L5 that rub periodically. And when it bothers me, it feels like somebody is sticking a screwdriver, a big screwdriver in my back, and sometimes wiggling around a little bit. And occasionally I'll get some numbness and tingling down one leg. Now, through exercises and stretches, I'm able to keep it from getting worse, and also, not digging ditches and other things where I bend a lot. I've kept it from getting any worse, but it's also not getting any better. Would you consider that chronic pain, and would you consider that a defense mechanism, or what's your take on that?
I actually love your story. It's a wonderful story about pain. So each of our pain is a story, basically. So the story about pain, your particular story, is what's happened in your life. It's what's gone on in your environment. So when we look at your pain, we look at, okay, what have you been told about your pain? What are your beliefs about your pain? What's the sensory input from your body that your brain is picking up? What are the socio-cultural norms that you believe about pain? So some of the things you said, like I have a long back. So let's kind of pull that apart. So did someone tell you that those with a long spine are more likely to have pain or to be weak?
No, nobody told me that. It's mostly that I've been a fairly tall person. I'm 6'2" now, and so I've always was taller than my classmates when I was a kid. So living in kind of a short person's world, I had to do some hunching and, maybe didn't have the best posture. So I was told that was probably a contributing factor.
Yeah, so that's I love the word contributing factor. So you start to look at, okay, maybe potentially I have some tightness in my joints because I have poor posture, and that tightness sends a certain signal to my brain. So I have to work on that tightness through exercise and stretching. You mentioned facets rubbing and potentially some imaging studies. And what's really interesting about back pain specifically is that imaging studies, so what you see on an X-ray or an MRI, is extremely poorly correlated with one's reports of pain. So if I were to pull 100 people off the street and give them an MRI of their back, upwards of 80% of those people would have some type of degenerative change, a facet change, a herniated disc, arthritis. Something would show up on the image. But if we look at those people, many of them would have no pain at all. So imaging studies are poorly correlated with pain. However, how someone explains that imaging study to you can affect your pain experience. So it may incite fear in you. So if someone says, wow, you have a really large herniated disc in your back at L4, L5, you may become very fearful then of moving. And that's what's called fear avoidance behaviors. Mm-hmm. You mentioned that your back pain feels like a screwdriver, being twisted in your back. So those are very cognitive perceptions of pain. Now, of course, there's no actual screwdriver there, but your cognitive perception of what's going on in your back can actually make that pain experience worse. And the other thing you mentioned is not only do you have some pain, but you have some numbness and tingling, right? And that happens intermittently. So your brain can do many, many things to change your behavior. Pain is only one of them, but numbness is another one. Tingling is another one. Tightness and muscle weakness is another one. So your brain creates all of those outputs as a way to change your behavior and to alert you as to say, hey, something is wrong here. Let's figure out what the cause is. So you kind of, what I've done just now on our little call together is I pieced through just a couple of points that you've given me about your particular pain experience and how it relates to your pain threshold, so to speak. And oftentimes what we do with patients who have chronic pains, we start to kind of create a curriculum for them and break down all these points and try to, in some ways, rationalize it for them and explain it to them in ways that's conceivable for them, and it starts to actually change their pain experience. When I say, hey, you may have a little bit of facet degeneration on your X-ray or your MRI, but the truth is those changes are present in 90% of the people, no matter who you are. So then you start to say to yourself, well, okay, if those changes are present in most people, then that means I can do a little bit of exercise and not be scared of it. So I can do a little bit of healthy movement. Or, when I feel the numbness and tingling, it tells me that there's something else going on in my life. Is it my stress? Is it my sleep? Is it my diet? Is it my relationship? So you start to figure out, okay, what is the warning sign here that my body's trying to tell me? And there are many of those.
So do you come to any sort of conclusion based on what I said of how I can remedy this? Do I just think it away and pretend it's not there? Because you said you mentioned a couple of cognitive things, and that it's essentially my mind. Now, if I were to meditate that I have a healthy back, do you suppose that would make it healthy?
Well, first, the thing I want to make clear to everyone who's listening is that when I talk about pain being in the brain, doesn't mean that you're crazy. Everyone's pain is real. It's just that there's not one part of the brain where pain is processed. So we're talking about multiple parts of the brain. So there are two things we know that help with pain. One is healthy movement, And there's a number of reasons why movement helps people with pain. We know that, of course, it makes you stronger. It makes you more flexible. It helps balance hormones. It helps increase blood flow. But when you get kind of into the more deeper levels, ultimately healthy movement helps release your body's natural endorphins. So I like to tell people there's actually a pharmacy in your brain that you can turn on your own. And healthy movement is probably the best way to actually do that. The other thing about movement is if you've been avoiding movement because you have pain, and this happens many, many times with people with back pain, they stop exercising, they stop doing their normal activities of daily living, that when you start to integrate some what's called graded movement, so a little bit of movement each day or a little bit more movement week by week, it sends a signal to your nervous system that, hey, I can do a little bit more each day and I'm getting stronger, which means that I'm safe. So as your confidence level increases, oftentimes fear decreases, and when fear decreases, pain decreases automatically. So movement is essential, and obviously as a physical therapist, that's one of the things that I focus on with patients. But there are really deep reasons why movement works beyond kind of like the physical, muscles and bones and joints. The other thing is stress reduction is a major factor in people's life. When you tend to reduce stress, pain gets better and pain tends to go away.
Yeah, that's definitely true. Stress will amplify the negative and de-emphasize the good feelings.
Yeah.
So is this
right.
kind of how your book works? It instructs people to take things step by step and really look at where the pain is coming from, or how would you describe the method your book uses?
So the book has three tenets to it. One is a nutritional approach to alleviating pain. The second is a movement approach to alleviating pain. And the third is what I call the brain in pain, and that's some of the cognitive strategies that we've talked about today. And what's interesting about pain, in addition to movement, just learning about pain, because right now many people who have chronic pain, they think that if I feel pain, it means I'm damaged in some way. Like if I have knee pain or joint pain or hip pain, it must mean that I'm damaged. My spine is degenerating. My knee is degenerating. I have a disease, and it means I shouldn't move. And what's really interesting with chronic pain is the more people learn about pain, and they learn some of the behaviors that affect pain, they figure out that, well, this isn't really a death sentence. It doesn't mean that I'm damaged. I can actually continue to live and make some changes that will affect my pain in a positive way. So the final chapter in the book is called The Brain in Pain, is often one of the most eye-opening experiences for people because it starts to shift their thinking about what pain actually is. And when you do that, again, it decreases fear, and when fear decreases, pain decreases.
Well, that's nice. That's great. What kind of success rate have you had with this technique?
Well, what's interesting is that I have an online program. It's called Heal Your Pain, Heal Your Life. And I created that program because with 116 million people in the United States, we don't have enough practitioners to treat those with pain. So I have all sorts of people coming in, those with autoimmune disease, those with, changes you might see on an MRI, such as arthritis. I even have people with I have a spinal cord injured patient in my program right now. And what's fascinating is when people learn kind of these immune buffering behaviors, they figure out that I can actually have control of my pain. I can actually influence my pain. And what I've been told about pain in the past has not been true. And as they learn to kind of bust these myths around pain, and their experience with pain, the way they perceive pain starts to change instantly. And people said, I had no idea that this information was out there, let alone in a book or an online program. And people's lives change completely because ultimately, when you change pain, your entire life changes. So your relationships change, your activity level changes, and when your activity level changes, you start doing things that you never thought you could do before. And I have people tell me, once I did your program, I had no idea I could get back to, and these are simple things, going out and walking in the mall and having lunch with my friends, or, getting on the floor and playing with my granddaughter or my grandson. So people's lives start to change within a matter of, 3 to 4 weeks.
Wow, that's pretty awesome. That's definitely pretty inspiring as well. Because, like you said, pain is a huge problem in this nation, and so many people want to reach for that bottle because it is, in a sense, a quick fix. But, of course, it's never-ending and can lead into so many other problems and doesn't doesn't cure the problem at all. So being able to get to the heart of it and even use the power of the mind to decrease it, I think is a really great technique.
Yeah, and you mentioned getting to the root of it. If people are interested in figuring out the root cause of their pain, they can go to, I have a great quiz. It's called the Pain Quiz. They can find that at www.thepainquiz.com.
All right, so I like this pain quiz. You have 10 questions. You put your name in there. And what happens when somebody clicks to see the results? Does a person respond to them and give some sort of information?
So when they go to thepainquiz.com, there's, like you said, there's 10 questions there, and it's almost like a little quiz or assessment on what's going on in your life. So it asks about some nutritional influences, it asks about some stress, and it actually gives you a couple of, quiz questions on what your beliefs are around pain. And then it'll give you a response. It'll tell you what the answers are. And then it gives you a little paragraph or a little couple sentences about each question explaining just what it is and how it relates to your specific pain experience. So you'll get some strategies about how you can heal your pain from it.
Oh, wonderful. That's fantastic. That's fantastic.
It's been a great podcast with you. I love talking about pain and all the different ways in and out of it. And I just, hope people can pick up the book, Heal Your Pain Now, and check out thepainquiz.com.
All right. And I will have links to your pain quiz and to your main website on my show notes page at livefitpodcast.com as usual. Dr. Joe, I wish you the best of luck and continue healing pain. Get rid of that stuff. We don't need it. We don't want it.
Great. Thanks for chatting today, Glenn. It's been great being with you.
Yeah, great talking to you too. You have a great one.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes, articles, resources, and learn more about our weight management programs at livefitpodcast.com. Once again, thanks for listening, and always remember to live fit.